What are the symptoms of internal OS closed pregnancy?
Hello, viewers. Today we're going to tackle a subject that's important to many expecting mothers: understanding the signs and symptoms of a pregnancy condition known as internal OS closed. This term is used when the opening to the uterus, also called the internal cervical OS, remains closed during pregnancy. This is a normal part of pregnancy, but let's discuss the specific symptoms that come along with it.
What is internal OS closed pregnancy?
During a normal pregnancy, the internal OS, or the opening of the cervix that leads into the uterus, remains closed. This helps protect the developing baby by keeping unwanted substances out and the amniotic fluid in. It usually opens when labor begins. Therefore, an internal OS closed simply refers to a normal condition in pregnancy before labor starts. It's important to note that the lack of symptoms is the norm for this condition. In other words, if your pregnancy is going smoothly, it's likely that your internal OS is closed, as it should be.
When should the internal OS open?
The internal OS typically opens at the onset of labor. This allows the baby to pass through the birth canal. If the internal OS opens too early, it could lead to complications such as preterm labor or miscarriage. So, a more pertinent question might be, what are the symptoms if the internal OS opens prematurely? These symptoms might include backache, pelvic pressure, cramps, increased vaginal discharge, changes in vaginal discharge, and contractions.
What to do if you notice symptoms of early opening?
If you experience any symptoms associated with an early opening of the internal OS, it is crucial to contact your healthcare provider immediately. They can perform a physical exam or ultrasound to assess the situation and provide appropriate treatment if necessary. Remember, an internal OS closed is a normal part of pregnancy and typically doesn't come with its own symptoms. It's when this opens prematurely that you might notice signs and need to consult a healthcare professional. We hope this video has been helpful in understanding this aspect of pregnancy. As always, if you have any concerns about your health or your pregnancy, reach out to your healthcare provider.